Health benefits of vitamin A. Supports eye health, could boost immune system. Necessary for a healthy pregnancy. May improve certain health conditions. Can enhance mental function. Good sources of vitamin A is found in both plant and animal foods. Plant foods contain vitamin A in the form of carotenoids, like beta-carotene, while animal foods contain preformed vitamin A. Here are some of the best dietary sources of vitamin A. 1. Carrots, raw, per chopped cup, 119% of the DV. 2. Spinach, per half cup, 64% of the DV. 3. Cantaloupe, per cup, 30% of the DV. 4. Sweet red peppers, per chopped cup, 13% of the DV. 5. Mangoes, per whole mango, 12% of the DV. 6. Hard-boiled egg, per large egg, 8% of the DV. Many other plant and animal foods are also high in vitamin A, which is why a vitamin A deficiency is rare in people who follow a well-rounded diet. If you have dietary restrictions, talk to your healthcare provider for a referral to a registered dietitian who can help you make a list of foods high in vitamin A that suit your dietary needs. How to consume vitamin A. While you can absorb vitamin A directly from certain foods, it's also available in the form of vitamin A-only supplements. You can also find this vitamin in multi-nutrient supplements, like multivitamins. Vitamin A supplements come in several forms, such as capsules, tablets, liquids, gummies, and powders. Vitamin A is a fat-soluble nutrient, which means it's better absorbed with fat. Micelles, which are a cluster of molecules your body forms when it digests fats, can boost the absorption of vitamin A in the small intestine. That said, you can take vitamin A supplements at any time of day, but it's best to take vitamin A supplements with meals or snacks containing fat. Dosage. Your body absorbs preformed vitamin A much more efficiently than provitamin A carotenoids. For example, between 70 and 90% of preformed vitamin A from supplements are absorbed in the digestive tract compared to 8.7-65% of beta-carotene. Because of this significant difference, recommended intake levels for vitamin A are given as retinol activity equivalents, RAE, which represents the amount of vitamin A absorbed in the digestive tract. 1 microgram mcg array is equivalent to 1 mcg of retinol, 2 mcg of supplemental beta-carotene, 3 12 mcg of dietary beta-carotene, 4 24 mcg of dietary alpha-carotene or beta-cryptoxanthin. The current recommended daily allowance, RDA, for vitamin A in adults is 700 mcg RAE for people assigned female at birth and 900 mcg RAE for people assigned male at birth. The RDA for pregnant and breastfeeding people is 770 mcg RAE and 1,300 mcg RAE, respectively. Doses of vitamin A used in supplements vary, but most vitamin A-only supplements contain around 3,000 mcg RAE or 333% of the DV. Multi-nutrient supplements, like multivitamins, often contain lower doses of vitamin A, usually between 750 to 1,050 mcg RAE or 83% to 117% of the DV. Is vitamin A safe? When used appropriately, vitamin A supplements are safe. However, preformed vitamin A can accumulate in the body, primarily in the liver. Consuming too much preformed vitamin A can lead to vitamin A toxicity, which can lead to serious side effects, some of which can be life-threatening. Vitamin A. Toxicity is usually related to ingesting very large doses of preformed vitamin A supplements or vitamin A-based medications. Acute vitamin A toxicity occurs within a few days to weeks after ingesting a very high dose of vitamin A, usually exceeding 100 times the RDA. Chronic vitamin A toxicity can occur when someone regularly takes high doses of vitamin A over longer time periods. High doses of preformed vitamin A can also cause congenital anomalies, previously known as birth defects, including deformities of the eyes, lungs, skull, and heart. Because higher doses of preformed vitamin A can be dangerous during pregnancy, Pregnant people should avoid taking vitamin A in doses exceeding 3,000 mcg RAE or 10,000 IU per day. Though provitamin A carotenoids are much safer than preformed vitamin A in terms of toxicity, taking high doses of beta-carotene has also been associated with an increased risk of lung cancer in people who smoke cigarettes. When buying a vitamin A supplement, make sure the product is third-party tested. Unlike medications, supplements are not regulated by the FDA. This means their quality and safety can vary. Third-party testing confirms that the supplement contains the ingredients listed on the label and is free from harmful contaminants. Check for seals from reputable organizations such as NSF International, USP, United States Pharmacopeia, or Consumer Lab. Can you take too much vitamin A? Yes, it's possible to take too much vitamin A. Taking too much preformed vitamin A can be dangerous and even life-threatening in extreme cases. Because preformed vitamin A can harm health when overconsumed, it has a set tolerable upper limit, UL. A UL is the maximum daily intake of a nutrient unlikely to cause harm. The UL for vitamin A is set at 3,000 mcg or 10,000 IU daily. It's important to avoid exceeding the UL, as taking high doses of preformed vitamin A can lead to serious side effects, such as vitamin A toxicity. Side effects of vitamin A. Vitamin A toxicity, also known as hypervitaminosis A, can cause the following symptoms. 1. Severe headache. 2. Poor appetite. 3. Eye problems. 4. Muscle pain. 5. Nausea and vomiting. 6. Dry skin. 7. Fatigue. 8. Depression. 9. Liver injury. In extremely serious and rare cases, vitamin A toxicity can also lead to coma and potentially be fatal. Vitamin A deficiency can lead to several health issues, affecting both vision and general well-being. Some of the key health problems associated with it include 1. Vision problems. Night blindness. One of the earliest and most common symptoms of vitamin A deficiency is difficulty seeing in low light or darkness. Xerophthalmia, a severe condition where the eyes become dry and thickened, which can eventually lead to blindness if untreated. Corneal ulcers and scarring. In advanced cases, vitamin A deficiency can cause corneal ulcers, which may result in irreversible blindness. Weakened immune system. Increased risk of infections. Vitamin A plays a critical role in maintaining the integrity of the skin and mucous membranes, which are vital for protecting against infections. Deficiency can lead to more frequent and severe infections, particularly respiratory and gastrointestinal infections. Higher mortality rates in children. Children who are deficient in vitamin A are more vulnerable to infections like measles and diarrhea, which can be fatal in severe cases. 3. Skin issues. Dry, rough skin. Keratinization. A deficiency in vitamin A can cause the skin to become dry, scaly, and rough due to the overproduction of keratin, a protein found in the skin and hair. Follicular hyperkeratosis. This condition results in small, raised bumps on the skin, especially on the back of the arms and thighs. 4. Growth and development delays. In children. Vitamin A is essential for normal growth and development, and a deficiency can lead to stunted growth and delayed development in infants and young children. 5. Reproductive health. Infertility. Both men and women can experience fertility issues due to inadequate vitamin A levels, as it is necessary for proper reproductive function. Pregnancy complications. In pregnant women, vitamin A deficiency can increase the risk of maternal mortality, as well as complications like preterm birth and low birth weight in newborns. 6. Increased risk of anemia. Vitamin A plays a role in the production of red blood cells, and its deficiency can exacerbate anemia, especially when combined with other nutrient deficiencies like iron. Addressing vitamin A deficiency typically involves dietary interventions, such as increasing the intake of vitamin A-rich foods, e.g., carrots, sweet potatoes, spinach, and liver, And in severe cases, supplementation or fortification strategies may be recommended to prevent long-term health issues. A quick review: vitamin A is the collective name for a group of fat-soluble compounds that play vital roles in health. Taking vitamin A supplements may be necessary for certain people, such as those with malabsorption issues and pregnant or breastfeeding people. Vitamin A supplements may also benefit vision, immune system functioning, and brain health. While vitamin A supplements have benefits, be sure to talk to your healthcare provider to ensure these supplements are safe for your body's needs.